much. Good morning to everyone. I would like to thank the organizers for giving us the opportunity to participate in this very interesting conference. Now I'm trying to share my screen. I don't know if you can see.
Yes, it is visible. Thank you.
Okay, thank you. So the topic of our presentation is about the Greek welfare state under permanent strain. Well, we will see some transformations, reforms, and structural problems, as well as some challenges that the COVID-19 has posed to the Greek welfare state. Well, actually, this is the structure of the presentation. So we'll see there's some structural issues, the external pressures because of the financial crisis. What challenges the pandemic has posed to the Greek welfare state? What are the inefficiencies that should be addressed, and some lessons learned for the Greek welfare state? Well, we should first point out that the Greek welfare state is included in the Southern European welfare model, as it shows some important common features and historical or institutional paths with the other welfare states of this region. We should point out some internal parameters, which in conjunction with the external pressures, such as the economic crisis, played a crucial role to the persistent crisis of the Greek welfare state. So to this end, the basic characteristics of the Greek welfare state are the highly fragmented and corporatist income maintenance system marked by internal polarization, whereby peaks of generosity, for example, in pensions, were accompanied by gaps of social protection. The departure from the corporatist traditions in the field of healthcare and the establishment of at least partially universalistic national health services, a low degree of state penetration of the welfare sphere, and a highly collusive mix between public and non-public actors and institutions. The persistence of clientelism and the formation of elaborate patronage machines for the selective distribution of cash subsidies, and also the resilience of reform-resistant practices and institutions when faced with external challenges that are also very important. We should point out that unlike Western Europe, in which industrialization was further promoted and increased the need for the establishment of welfare state services, in Greece and further in the other South European countries, they remained agricultural and relatively underdeveloped, heavily reliant on state support. Other reasons that explain this lag can be found in strong authoritarianism and the difficult transition to democracy, as well as in the extensive clientelism. In other words, Greece suffered politically and socioeconomically as it lost the pace and trailed behind Western Europe in state modernization before 1980s. It is supported also for several scholars that in comparison with the continental and North welfare systems, the late modernization, industrialization, and democratization that characterized South European welfare states and especially Greece limited the space to resolve the existing problems and hindered the establishment of socially just and effective welfare institutions. While social vulnerability and inequality were quite extensive before the financial crisis, and they were exacerbated during the financial crisis and after the financial crisis, and there were actually, there is a system of insiders, outsiders. As insiders are the employees of the public and large private enterprises, and outsiders, the employees of small enterprises under flexible contracts. The insiders-outsiders cleavage draws its origin from the labor market separation into three sectors. So the core, the peripheral, and the underground. The core sector was characterized by employment stability and strong protection rules due to the realization of the male breadwinner system. The peripheral includes small enterprises, mainly in that services and construction sector, and is characterized by job instability, low protection, low wages, and more labor flexibility. And the underground sector encompasses non-formal and informal workers and a black economy, followed by also informality instability and low wages. So this situation inevitably raised job polarization, brought about widespread social vulnerability problems, and these are, for example, high levels of poverty and social exclusion for the young people, the needs phenomenon of social vulnerability, child and old age poverty, and gender pay gap. So this constructed a welfare state which was contingent on pensions and the male breadwinner protection. So this is a strong evidence how the welfare state failed to address social problems, such as, for example, old age poverty, excluding measures on childcare, safety nets, and active labor markets programs for the youth and other vulnerable social groups. It is noteworthy that the participation of women in the labor market was extremely low during the 1970s, and only from 1980s it started to grow, but still remains comparably lower than the Western and the Northern European countries. And also after the 1980s, Greece has experienced a raft of drastic changes in the labor market. And this led also to the financial crisis during after 2008, which was actually the external impacts. So beside the structural problems, the contribution of the economic crisis seems determinant for rising social vulnerability and social problems. Thus, the welfare states of the periphery of the Eurozone, and especially of Greece, were confronted with tight budget and serious economic pressures. The exacerbation of the general and youth unemployment at unsustainable levels became a structural problem. So we had here long-term unemployment and lowering prospects for reintegration into the labor market that increased the risk of poverty, social marginalization, and exclusion. So the cyclical form of this problem essentially suggests that greater resources for tackling rising problems are deemed necessary from the welfare state. So, for instance, lowering work levels squeezes insurance and tax contributions, and this means that it will be more difficult for the state to finance the social insurance system. So the result was that these problems have become even more acute for the most vulnerable social groups, also the decline in citizens' consumption potential has different effects on the economic sustainability of individual socioeconomic groups. For example, the middle socioeconomic groups in Greece witnessed a serious shift in their living standards during the crisis, and the change in consumer habits came as a response to a sharp increase in taxation that exhausted citizens' tax capacity. At the same time, the slashing of wages exposed to poverty risk a large proportion of citizens that belong to the most vulnerable groups, such as the immigrants and the youth, due to the inability of the social safety nets to address the fallout of the recession. So this trend depicts that the Greek case shows the highest levels of material deprivation in Eurozone and the highest increase amongst EU countries during the crisis. Well, actually, there were a lot of problems here also to access to some social goods, for example, to health. And I can show you here the inequality in access to health. For example, the inequality for the lowest socioeconomic groups, the first and the second quintile are the lowest socioeconomic groups. So the problems for accessing to health have been increased. And also we can see that Greece is one of the countries with the highest percentage of needs. Needs are the young people aged 16 to 24, which are out of employment, training, and education. So here we can see that actually the Southern Europe has the highest percentages, and Greece the second highest percentage. Then after the economic crisis, we have the pandemic. So during the years of the economic crisis, the main idea, which was persistent, was that the main patient was the welfare state. There were a lot of people who supported that the welfare state spends a lot of money, so we have to reduce it and change the patterns of its During the pandemic, well, this has changed because the pandemic highlights the necessity, and especially the necessity of the wider public health sector, which is very important. So it highlighted the importance of universal access to the NHS that will provide quality services to all citizens. So the role of the welfare state as a key mechanism for protection against risk is emerged during the pandemic. But what are the lessons learned from the pandemic about the welfare state? Well, actually, here we can see that there are a lot of shortcomings in the Greek welfare state. So serious reforms are necessary in order to be more efficient. So, for example, the primary healthcare support and the increase in ICU beds. Greece has one of the lowest rates of ICU beds and also of staff among the OECD countries, and also nursing staff and support also of research. This is very important in order to increase accessibility, efficiency, effectiveness, and quality of these services. So we have also some data here, for example, because human resources are necessary in the welfare provision sector. Even now, there were a slight increase in human resources in Greece, but still it has one of the lowest rates among the OECD countries. For example, in employment in health and social work as a share of total employment. Also, in practicing nurses per 1,000 population, still it has one of the lowest rates on that. So this is actually very important to be increased, especially during the pandemic. And the lowest rate of long-term care structures, beds and facilities in hospital. These are for the healthcare sector. And even though the healthcare sector is very, very important, we have to see the employment sector. Now we have teleworking, which opens some opportunities for trade, for innovation, but there are a lot of inequalities. I showed you before the inequalities in the labor market. So here we can see that rotational employment, pseudo-entrepreneurship, and non-formal employment are also have been also increased. So they have increased the inequalities again in the labor market. And there is also a disruption in the family work-life balance because we have the employee which is standby constantly. So the right to the disconnection is very, very important in order not to violate the working hours. We have increased working hours and mental problems. So there is a need from the welfare state to secure the labor rights and strengthen small and medium-sized businesses and create also incentives for new job vacancies. Why the medium-sized and small businesses? Because the highest percentage of the labor market is with these businesses. So it is very important to be strengthened. So what the pandemic had shown us, that nothing is self-evident, but if we have a welfare state that implements modern public policies, then we can reduce uncertainty. This is very important because we should increase the efficiency and tackle all these shortcomings and inefficiencies that I showed you. These are some, because of lack of time, there are a lot of more, but I showed you some of the most important shortcomings. Thank you very much for your attention.
Hey, thank you.